Hello and welcome to FIP's Transforming Conversations, the podcast series that brings together pharmacists from around the world to have in-depth conversations and share stories on topics related to leadership and personal growth, the highs and lows in their professional lives, and their unique experiences and lessons learned facing multiple challenges. Please let us know what you think and tell other people about FIP on social media. This is FIP's Transforming Conversations, and I am Dalia Burgess, your host. Welcome to another episode in the FIP Transforming Conversations podcast series. Today, my guest is Dr Mohamad Hijazi, an assistant professor at Beirut Arab University in Lebanon. Today marks the second anniversary of the deadly explosion on August the 4th, 2020, in the heart of the Beirut Port in Lebanon. The blast that stole the lives of 218 people, injured thousands, traumatized all, and shook Beirut to the ground. Following the collapse of the economy in 2019, Lebanon has been grappling with a health pandemic, political instability, and an economic meltdown, and was severely aggravated by the devastation brought by the 2020 blast. Mohammad, welcome to the call. It's lovely to have you with us today.
Thank you, Dalia, and it's my pleasure to talk with you today, and welcome to your audience.
Thank you, Mohammad. Reflecting on the 2020 Beirut Port blast, how have the latest crises affected you as a pharmacist and on a personal level?
As you know, Dalia, the 4th of August has become an ominous day that will dwell forever in the memory of every Lebanese. On the occasion of the second anniversary of that tragic day, no word can express the pain, the grief, and the colossal damage in our life and the life of Lebanese. For that, as a pharmacist, it's not the time only to stay in solidarity, but it's the time for unity. It's time for activity. I just want to remember our colleagues, pharmacists, we as a pharmacist, together with all healthcare providers who stand in the front lines in the fighting against COVID-19 pandemic. And we have succeeded in saving hundreds of souls of our populations and relieving or preventing injuries to hundreds and thousands of our populations. It's also the same time and the same recalling to stay in unity and to do our best practices to deliver our best services, whether physically, mentally, socially, psychologically, and keep our hands outstretched in order to help Lebanese people to improve their quality of life.
Thank you for sharing your thoughts. From FIP to Lebanon, we send a message of solidarity and gratitude to all pharmacists and healthcare workers and providers. We thank you for your resilience and your compassion, for your dedication to remain standing and serving at the front line. We thank you for upholding your professionalism and for your commitment to humanity in the most difficult of times.
Thank you, Dalia, and thanks for FIP members for your message and for your continuous support.
Mohammad, with over 13 years of experience in various pharmaceutical sectors, including community pharmacy, pharmaceutical companies, academia, and research, how do you think pharmacists in Lebanon responded during the pandemic, and what were some of the challenges they faced and ways they managed to overcome these challenges?
First of all, the situation, as you know, the situation in Lebanon was exceptional. It was a little bit much more challengeable than other countries. As you know, Lebanon is a small country in the Eastern Mediterranean region, We have about 5 to 6 million estimated population, with another 2 million Syrian and Palestinian refugees. Lebanon boasts the highest, or one of the highest density of pharmacists to population ratio, with 20 pharmacists for each 10,000 population. During the COVID-19 pandemic outbreaks, Lebanon was, or even before this pandemic, the recent crisis arose started from the October 2019. It's considered as the worst crisis in the history of the country, together with the political instability and civil unrest and the ongoing economical collapse, with currency discrepancies and the Beirut Port explosion, all together are challengeable factors and create very, very difficult situation for healthcare providers, especially for the pharmacists. On the other hand, the pharmacists were really competent to provide their best practices, to provide patient care and serving our patients in their best ways. At that time, where physicians were overwhelmed, where emergency rooms and hospital beds were overwhelmed, where even the phone call was very difficult to do with any medical centers, pharmacists were there, available, accessible, freely counseling patients, volunteering even in the prevention, in the preparedness of the patients, and following up their patients, even without any cost, or any burdens on the financial or the health system. Pharmacists in Lebanon are suffering because we have a severe shortage in the drug market. uh, Huge numbers of chronic medications and important medication like the anti-cancer medications are still absent from the market because of the importation difficulties and the transferring of fresh dollars to outside the country, and the limitations. Pharmacists were trying to find the alternatives, were trying to provide people with alternative solution, whether with medications or other non-pharmacological treatments or therapy or management. They really, not because I'm a pharmacist, what pharmacists did was really unbelievable, was phenomenal at the level of countries with these limited resources and with these burdened health system and weakened regulatory frameworks and the situation of the country.
That's really interesting. Do you think consumers' or patients' views of the pharmacist role changed in any way during the crisis in Lebanon?
Thank you, Dalia. This is a very good question. In fact, Lebanon, like other developing countries, sometimes the perception of the pharmacist as a drug dispensers, or sometimes, sorry to say it, as a drug sellers, and pharmacists feel that they are underestimated in the healthcare system. Yes, it has been changed dramatically during the COVID-19 because pharmacists were available everywhere. They are the first point of contact for millions or for hundreds of people looking for reliable information, looking for counseling, looking to follow up, for example, their medical records or their laboratory data. They need any supports or any help. Phones were available. Their phones were open 24 hours for any call, free calling, free counseling, whether physically on the pharmacies or online by phone calls and other applications. And as you know, the strict lockdown resulted on a greater dependence on the pharmacies, because the pharmacies are one of the few places that remain open for the public services, and the forms are available all the opening hours of the days. So it was and as you know, Lebanon, for example, the small country in the peripheral areas or regions, sometimes medical centers are not available or are not well equipped for that. The pharmacist was the main healthcare provider following or fighting or serving the population, whether in the preventive measure or in the counseling or the following up with the situation. And we have records of hundreds of patients and interventions by pharmacists in the Lebanon.
Let me tell our listeners a little bit more about you. You acquired a Bachelor of Science in Pharmacy from Beirut Arab University, and a few years later, you completed a Master's and a Ph.D. in the field of pharmaceutical sciences. But along the way, you were adamant to link science with practice, and most recently published a paper, along with other researchers in Lebanon, that examined the current matrix of the pharmaceutical workforce in Lebanon. See, at FIP, we believe it is imperative to bring science, practice, and workforce and education together into one transformative framework to our members and the wider profession to set out the goals for the development of the profession. How important do you think is linking science with practice and workforce and education?
It's crucially important. In fact, this is our philosophy at Beirut Arab University. We have developed our curriculum in order to have a hybrid program with an integration between the pharmaceutical sciences and the practice. I believe that science and education should serve the practices, and the practices should provide their needs to the researcher and to the educator in order to complement our targets of the patient. Our target or our primary competency is the patient care or serving our patient or the health and the quality of health of the patients. To do that, we cannot do it in the separate islands, education alone or researcher alone or practitioners alone. Being a pharmacist is different from being any other profession. Pharmacist, even if I am an academic or a researcher, I should keep my arm in the community in order to know or to identify the needs of our community and the developments of and the challenges in the practicing sites and what people need and what has changed. For that, I come back to my research to provide evidence, to search for a solution, to provide it for the our students, for the transfer it for the community for practitioner. And this is the cycle. This is our philosophy, and I believe that pharmacists should be like that to provide the best. This is the best response to the challenges and to the needs and to our competencies.
Thank you so much for that. Twinning teaching and research represent the best response to health-related challenges and to addressing communities' needs and ensuring the highest quality of patient and health services. I stole this from your biography. So I'm wondering if you could describe to our listeners the research areas you became involved in during the pandemic and how these recent experiences may have influenced research practices or strategies.
Again, it's an excellent question. Yes, I believe that research is not for publication. We can do a lot of publications and a lot of papers, but I think this is not the aim of our research. Our research should provide the needs of the community, should respond to the crisis and to the challenge. In fact, my basic research track, and I'm skilled in the drug discovery of natural medicine. This is the essence of my research and excellence in the research. But because again I'm a pharmacist, I belong to a healthcare profession. And because of the crisis and the challenges of the pharmacy profession, I started, for example, 5 years ago, another track for upscaling the pharmacy profession and the role of the pharmacist and how to transfer data and evidence into the practices. We did a lot of quantitative and qualitative analysis of the pharmaceutical market and workforces in Lebanon, and we provide evidence for the health authorities and for the regulatory bodies, even for the pharmacist bodies, how we can improve our practices, what are our needs, and we succeeded in certain places to upgrade our regulations and to upgrade uh, the role of pharmacists and implement a new culture in the pharmacy profession that meet the advancement in the healthcare systems and in the profession worldwide.
We learn from your answers, Mohammed, that adaptability is an important professional attribute that you describe. What professional attributes do you think were necessary for people to embrace and to face the pandemic head on?
Besides our ethical principles, our ethical attributes, besides our commitment for being healthcare provider, for being pharmacists, for caring about our patients, for serving our community, skills and excellence of practices and innovations and taking initiative was really one of the important attributes, especially for the Lebanese pharmacists. For example, in the situation of Lebanon, the market is out of any milk formula for babies. No more milk formulas, especially for newborn, is available in the market. You can imagine the difficulty of the situation. So, pharmacists, we are taking initiatives to educate patients or to direct also the physicians and provide counseling what to do in this situation. First, of promoting the breastfeeding. Second, increasing the lactation, providing suitable environments and suitable uh, sometimes herbal or supplementations, how to use the natural milk or the cow milks for the children's at certain age. And really, these initiatives and this creativity and this evidence of looking for new information or evidence and promoting in the community was essential in order to fight the global pandemic within all these crises at our community.
Do you think the pandemic changed academic views on lifelong learning and the importance of keeping up to date? Perhaps from your academic perspective and also from students' perspectives that you are engaged with.
It's also a very good question. Thank you, Dalia, for elaborating this issue. One of our competencies or one of our learning outcomes in the school and the faculty of pharmacy at BAU is to make our pharmacists graduates long life learner, to make them self-learner. As you know, the pharmaceutical education or the medical education is now student-oriented rather than professor-oriented. This is because simply every year the updates are no one can own the information worldwide. We have a lot of information and of evidence in the scientific community. And we have the pharmacist. When I did my first pharmacy practice research about the availability of the scientific resources and the availability of scientific evidence in the for the pharmacist, we have gap. We identify a gap in the scientific in the use and the accessibility of the pharmacist to scientific evidence and resources, and we implement this at our curriculum. through many courses to learn how to serve drug information and how to evaluate the literature. And as you know, the pharmaceutical market, including the non-pharmacological therapies, including the herbal supplements and vitamins, there are a lot of misconception about the uses, about the safety, about the efficacy, especially during the COVID-19. You know that people were in Lebanon. I don't know if it's the situation in other countries. We have the package of COVID-19, including vitamin D, zinc, vitamin C, and blah, blah, and other herbal products and supplementation and antibiotics and aspirin and so on. And all these were not evident, or there is no enough evidence to use them. For that, it was really a big chance for pharmacists, for students to believe in scientific resources and search for evidence before delivering or before dispensing medication, especially that we have a shortage in medication, especially that medication are not available, especially the high cost of the medication because of the currency discrepancies and so on. Now, after years, we prove for the community that, for example, this vitamin and this supplements was not effective either in prevention or in the treatment of COVID-19. People are more rely more in pharmacists now to know the reliable information and scientific evidence for every supplements or herbal products before they use. Students are convinced that they have to be a long learner. Just a simple example, COVID-19, we as a healthcare provider, we did not study COVID-19. It's a new virus. It's a new variant of the SARS viruses. No one knows the virulence, the activity, the treatment, and the guidelines. There is no guidelines. We have to learn from our practices, from our resources, from the research we and all the researchers do worldwide. For that, it really was a chance to convince and for all people to accept to be a long-term learner, a lifelong learner, and I think this is one of the positive impact of COVID-19 strategic impact on learning, teaching, and serving the community.
You are a recently joined individual member of FIP. What do you hope to benefit from this association, and what do you hope to give back to the global community of FIP?
In fact, before being a member of the FIP, I usually follow the reports and the recommendations and the sessions delivered by the FIP. It's really a chance to learn, a chance to grow with the pharmacist community worldwide. I would like to learn more from pharmacists, from their experience around the world, from their challenges and the way they solve their problems and they provide their best practices. It's very important to share our experiences and to learn from colleagues from other countries, especially sometimes we have high professional colleagues providing high professional services for the community. At the same time, I would like to provide my skills, my voice, with to share with my colleagues. They could help us to upscale the pharmacy profession and develop and protect the profession in the Lebanon. And then we can also provide evidence. We can provide our skills to help other colleagues or other countries that still struggling or still facing challenges and obstacles in the role of pharmacists and the pharmacy profession as a whole. I think it's my pleasure to be a member of IP, and it will be a very fruitful experience at that time.
Mohammed, we started the episode with a tribute to the second anniversary of the Beirut Port blast. And I would like us to conclude, if I may, with a question that if you were to unify your voice with other pharmacists' voices, What is one thing you would all agree on is needed to improve health and healthcare systems in Lebanon and in the world?
What's needed is all the pharmacists, all the healthcare providers, all the stakeholders, or the health authorities, especially those in relation to the pharmacy profession. We should sit together around the tables. We are in emergency situations. Really, the profession is threatened in Lebanon. We need to protect the profession not because of the pharmacist, not because of the profession by itself, because losing or weakening the pharmacy profession will consequently affect the community health and hundreds of patients' health in the community. It's not a profession that could be lost or that could be ignored in such community and in such situation. For that, it's an emergency call for all pharmacists, even the agency, whether the governmental and non-governmental and even the regional and the global institutions or agency that could help the pharmacists in Lebanon and the health system and health authorities and regulatory bodies in order to take a prompt action to protect, to develop, and to secure the pharmacy profession and pharmacists in Lebanon because of the health of the population and the community of millions of patients.
Thank you, Mohammed, for your time and for sharing your thoughts and experiences with us today from Lebanon. Good luck with all your future endeavors.
Thank you, Dalia, and thank you for your team and for all the FIP and FIP members for this chance to raise our voice from Lebanon to the world, and looking forward to work together, hopefully for the better of the profession and the pharmacists around the world. Thank you.
Many thanks to our guests. We hope you enjoyed this episode of Transforming Conversations hosted by FIP, the International Pharmaceutical Federation. Please let us know what you think and tell other people about FIP on social media.